Speaker, I recognize the Leader of the Opposition.
This tired and out-of-touch government is failing Saskatchewan families struggling with the cost of living.
That's right.
And new numbers from Angus Reid show what we already knew from talking to people in hockey rinks and on the doorstep. Right. Mr. Speaker, the cost of living is the #1 issue facing families across this province. Right. And with the holidays around the corner, budgets are stretched and families are stressed. Why won't the Sask Party scrap the fuel tax and give Saskatchewan families a break?
Hear, hear.
I recognize the Deputy Premier.
Mr. Speaker, we have never denied that there is pressures on individuals and families within our province when there is inflationary pressures. And let's be real, what's creating a lot of the inflation and the cost of living increase is the carbon tax, Mr. Speaker. And I, hope the members opposite will recognize that, which is out of our control and driven by our federal Liberal NDP government. But, Mr. Speaker, what we are proposing as a government is we are going to not charge the carbon tax on home heating fuel, which is actually worth more to the individuals than what they are proposing.
Recognize the Leader of the Opposition.
Mr. Speaker, Saskatchewan families are struggling, but that minister who has no regrets about an $8,000 trip to fly to North Battleford for lunch, Mr. Speaker, is clearly out of touch with that reality. Here's the reality. We lead the country in mortgage arrears, and this tired and out-of-touch government has made things even worse, raising fees and taxes, raising power bills 3 times in 1 year. That's right. Mr. Speaker, families need a break, and they're struggling to put gifts under the tree. Right. Will that minister finally deliver some cost-of-living relief for these families?
Here, here, here.
Recognize the Deputy Premier.
Here, here.
I'd like to caution the Leader of the Opposition, because I do believe that my travel is less than hers.
There you go. There you go.
So I would just caution and I definitely have lower travel than any finance minister under the NDP. So, Mr. Speaker, as the member opposite knows, that when compared to other provinces across the country, excuse me, if you would like to hear the answer. Across the country, when you compare taxes, housing, utility costs, we are the most affordable province in the country, Mr. Speaker. That's due to measures that's in this budget. The Leader of the Opposition has said a number of times that there's tax increases in this budget. In fact, there were no tax increases in this budget that we introduced in the spring.
Recognize the Leader of the Opposition.
For the record, Mr. Speaker, I drive to North Battleford like most people in this province. But this tired and out-of-touch government is failing on the cost of living, and they're failing when it comes to women's health care. Let's look at the record on mammograms. Gail Greenberg was interviewed in the Regina Leader-Post about her 8-month wait for a regular mammogram. Mr. Speaker, I quote, "At age 71 years, it's not something to delay. You can imagine my shock. You hear far too many stories of testing delayed, and then by the time you have the test done, something that should have been discovered earlier is discovered too late." End the quote. Mr. Speaker, will the Minister of Health apologize to Gail and to the women of this province who are paying the price for this government's total mismanagement of our public health care system?
Here, here.
Recognize the Minister of Health.
Thank you, Mr. Speaker. As we have discussed a number of times in this chamber, that there is a waiting list for in healthcare for biopsies and diagnostic mammograms as a result of a shortage of a specialized breast radiologist here in the city of Regina, Mr. Speaker. And we are taking steps, both medium and long term, but also, as I've discussed previously, on the short term, to address people's concerns when they are waiting for these tests and procedures, Mr. Speaker. We will continue to do this work to make sure that we are working working on that wait list to cut it down. As a result of that, that is the reason why, as a temporary measure, we have signed a contract with ClearPoint out of Calgary to provide an additional 1,000 biopsies and diagnostic mammograms and ultrasound procedures to make sure that we are cutting down that waiting list, getting those women the procedures they need on an urgent basis, in addition to the work that's being done here in Saskatchewan to make sure that Saskatchewan women in this province are also getting those procedures done here within our borders, Mr. Speaker.
You're here.
Recognize the Leader of the Opposition.
Mr. Speaker, let's talk about the Band-Aid solution from that Minister of Health. This government sole-sourced mammograms to a private Calgary clinic, paying almost 10 times more than what we pay in the public system. At least, Mr. Speaker, that's what the minister said in the media.
Right.
But the actual contract with the company providing these scans under this deal, well, that has been redacted. The cost that we're all being forced to pay to a Saskatchewan Party donor is being kept secret. Why the secrecy, Mr. Speaker? Why won't the minister tell the people of Saskatchewan how much we're paying for these scans?
You're here.
Recognize the Minister of Health.
You're here.
Mr. Speaker, we've been very clear on what the contract is with ClearPoint in Calgary, Mr. Speaker, and what that cost is, Mr. Speaker. Now, the members opposite, their numbers aren't exactly accurate. They were saying earlier this week that it was 10 times more. Mr. Speaker, that is not a apples-to-apples comparison. Mr. Speaker, there are additional costs in there, management costs, facility overhead costs, some of the other procedures that are included as part of this, ultrasound-guided biopsy, diagnostic mammography, and tomography. These are all additional services that are provided in Calgary over and above what would be done here, Mr. Speaker. But it's interesting once again that the members opposite, they want to talk about the cost to the healthcare system. They don't want to talk about actually getting these patients and getting these women the procedures and the biopsies that they need on an urgent basis, Mr. Speaker. They're more concerned about the process. Mr. Speaker, if we were to start from scratch, this would take months. But I guess that's what they would prefer, is to spend months and months and months as opposed to getting these people. And I can report to the chamber, Mr. Speaker, that as of today, 41 women are now being referred to Calgary, Mr. Speaker.
Here, here.